All right, welcome to our Moving with MS virtual support group. I'm really excited for our conversation today because this is actually a brand new topic that I've never discussed before in any support group or on any platform, but it's something that is so important. So today we are going to discuss the most common muscle groups that MS tends to attack. As we all know, multiple sclerosis is different for every person that has it. That's why it's nicknamed the snowflake disease. But it does tend to attack specific muscle groups. And for some people, that might mean that their muscle group is weak. For others, it might mean that it's tight. So we're going to cover not only just what muscle groups MS tends to attack, but what will happen if it's weak, or if it's tight, and exercises that you can do if it's weak or tight. So before we dive in, if you don't know who I am, I'm Dr. Gretchen Hawley, a physical therapist and MS certified specialist, and I partner with MS Views and News to bring this support group to you guys, and our supporter is Viatris, so a huge thank you to them. Okay, so as I mentioned, we are going to be talking about leg muscles in MS, specifically understanding weakness and tightness. So a quick overview, we are going to learn the 5 key muscle groups that MS tends to attack or affect. We're going to understand the signs and weakness, or signs of weakness versus tightness, because those are 2 different things and they need to be treated differently. We'll discover how these muscles affect your walking and things like stair climbing and just general movement throughout the day. And then learning exercises to improve the strength and or reduce the tightness. So a quick recap before we dive into the specific muscle groups and what that means for you is we do need to understand what neuroplasticity means, and more specifically, how it relates to strengthening a muscle. So when you have MS and when you're experiencing muscular weakness or muscular tightness, we often think that the problem is in the muscle. And you're not wrong, that is where the problem is, but it's not because of the muscle. The problem actually originates in the neural pathway. So the way that any muscle needs to work is, first and foremost, our brain needs to have the thought or the reflex to move a muscle. Then, after our brain has that thought or reflex, in order to get to the muscle, that message has to travel down a bunch of neural pathways. So pathways from your brain down to that muscle. And in MS, that is where the problem lies. That neural pathway, or lack thereof, is the reason that you have muscle weakness or muscle tightness. And therefore, if you've tried regular physical therapy, regular exercise, traditional PT, and it hasn't worked for you, that's usually because you're focusing on muscle strengthening, muscle stretching, and forgetting about the neural component that connects your brain to your muscles. So we have to consider that when we're talking about MS. We will still be strengthening muscles, we will still be stretching muscles, but in a way where it's conducive to improving our neural pathways, which again is the connection between our brain and any muscle that we're working on. And that's the power of neuroplasticity, the ability of your brain to strengthen those neural pathways or find a brand new neural pathway if the original one wasn't working. So another quick recap, because hopefully you know what neuroplasticity is, we've talked about this before, is to remind yourself that your brain can strengthen current existing neural pathways. So if you go to move your leg, and it does move, but it doesn't move as well as the other side. Maybe it feels heavier, maybe it feels harder, maybe it doesn't move as much. That is a sign that your neural pathway for that muscle is there and it's working, but it's not as effective as it used to be. Neuroplasticity is the ability to strengthen that neural pathway so that it does get to be as strong as it used to be, or at least closer to where you are from where you are now. Neuroplasticity is also the ability to find new neural pathways. So if I were to tell you to lift your leg and nothing happens, that means that the neural pathway from your brain down to lifting your leg is not there, or it's not working. And so neuroplasticity is the ability of your brain to find a different way to get from point A to point B, being your leg. So it does both of those things. Strong neural pathways equals strong muscles. Movement quality matters more than quantity. Consistency is key, and start in easy positions. When we're talking about exercising and when we get to the examples today, the easier it is for you to do, the better. So often people think that modifying to do an exercise in a different position or making it easier is cheating. And that is not the case at all. That couldn't be further from the truth. The best way to strengthen your neural pathways and to find new neural pathways is through repetition of the desired movement. So if you can't do a lot of repetitions because the exercise is too hard, then you're not giving yourself too many opportunities to find or strengthen that neural pathway. But if you modify and you do that exercise in an easier position, therefore you can do lots of repetitions, that's lots of opportunities for your brain to strengthen or find a neural pathway. So for any exercise that we talk about today, if you find a way to modify, absolutely go for it. That is not cheating. It is a good thing. You want your exercises to feel as easy as possible. So the 5 muscle groups that we're going to be discussing are the hip flexors, the knee flexors, knee extensors, ankle dorsiflexors, and your calf muscles or your plantar flexors. So your hip flexors are the muscles on the front of your hip. I'll show you in a second here. But first, I just want to describe to you where our hip flexors are and what they do. So our hip flexors are on the front of our hip. And they are the muscles that are responsible for lifting your leg, lifting your knee up towards the ceiling or up towards your chest. When you think of lifting your leg, that is your hip flexor that is responsible for that. There's a few different muscles that make up your hip flexors. It's not just one, but strength in this muscle is essential for anything that we have to do with lifting our leg, meaning walking, taking steps forward or backwards or sideways, stair climbing, lifting your leg to get into bed or out of bed, lifting your leg to get into or out of a car. Anytime you have to lift your leg, whether from a seated position or a standing position, that is hip flexors. We need strength in our hip flexors in order to do that. So when our hip flexors are weak, what's going to happen? And this is really interesting way to discuss the hip flexors because some people don't know what muscles are weak. They just might know it's hard to lift my leg or it's hard to straighten my knee or bend my knee, whatever it is. But knowing where your weakness is specifically can help you find exercises that are much more likely for you to see big progress versus just doing general strengthening exercises. So if any of this resonates with you, know that your hip flexors might be weak or they might be tight. Okay, so going back in, if your hip flexors are weak, some things that you might notice are difficulty when lifting your leg when walking, dragging your leg during the swing phase of gait. So when you're bringing your leg forward, if you feel like your leg is kind of dragging, it could be due to weak hip flexors. If you have to use your arms to lift your leg at any point, if you have to use your arms to lift your leg to get into the car or out of the car, or lift it to get in or out of bed, lift it to get into or out of the shower, if you're lifting with your arms, that is a big, big sign that your hip flexors might be weak. And last but not least, compensating by swinging your leg around when you're walking. also known as hip circumduction. So if you don't have enough strength in your hip flexors, your leg might swing around as you take that step forward. When your hip flexors are tight, because tightness is different from weakness. When your hip flexors are tight, you might find that you are leaning forward more, especially when you're walking or standing, but even when you're sitting. So if you find that you're kind of hinged forward, that might be due to tight hip flexors. If you have low back pain or low back discomfort, that is a huge sign that you might have hip flexor tightness. If you have difficulty extending your hip fully, meaning bringing your leg back behind you or fully coming up to a tall standing position, not hinged forward, that is a sign that your hip flexors might be tight. And if you feel like your balance is off or your posture is off, tight hip flexors are often a big culprit. So if you feel like you said, yes, that's me, to any of those, let's review some exercises that might be helpful. Seated marching, and I'm going to demonstrate in a second here, but seated marching can be hugely beneficial. Standing marching, with or without support, and hip flexor stretches. Okay, so let's go through those exercises. And let's actually start. My chair out of the way. Okay. So our hip flexors are right here. They are in the front of our hips. So when they are weak, that's when I was saying that it would be hard to lift your leg, whether you're standing or sitting, or maybe you feel like you're dragging your leg forward when you're walking because you can't lift it up well, or maybe even circumducting. You're swinging your leg around to the side because that uses different muscles than this and bringing them up. Or if your hip flexors are weak, that's when I was discussing that you might be hinging forward because they're tightened. Or sorry, not when your hip flexors are weak. If your hip flexors are tight, you might be hinged forward like this because those muscles are tightened and shortened. It would be hard for you to fully extend, hard for you to get your leg behind you due to tightness here. So some exercises that we can do are a marching exercise. That's my favorite exercise to strengthen these. I'll show you how to do that seated and standing. And then also a stretching exercise for your hip flexors. So let's start with the marching exercise. Move this over here. I'm going to use this chair because that's the chair that I have here. For any exercise, don't use any chair that has wheels on it. If you're going to be doing a seated marching exercise, you can sit up tall and lift and lower, lift and lower. And just know that sitting up tall, I personally think is the hardest way to do this exercise. So as you're doing this right now, if you're thinking, oh my gosh, I can't do this at all, there's easier ways. Way to modify, number one, is to recline backwards and try it there. That can be easier. Or you can do a standing version with or without a mobility aid where you're lifting up. And I'm exaggerating by lifting up high. It's okay if you can only lift this much. Do whatever you can. When we're talking about strengthening our muscles, you don't need to be able to lift high in order to strengthen them. You just need to activate that neural pathway, which means you're attempting, you're putting effort in. So this would be the standing marching. And then the stretch, to stretch tight hip flexors, you can do standing or seated. The standing variation is to put one leg behind you. So you're in a staggered stance and you tuck your butt under. And from that, you should feel a stretch in the hip flexor of the leg that's behind you. So this is what it looks like from the side. This is what it looks like from the front. So you can see my feet are wide. I am not in a tandem stance and like this. So this is how you can do this standing. And of course you would do both sides, really tuck that butt under, feel that stretch here. If the seated option is best for you, And you could do that while holding on to a mobility aid if you needed to. The seated option, you're sitting towards the edge of your chair, opening your knees and turning, then tuck your butt. And it's that same style. If I were to stand, I look like this. So it's the same thing, I'm just sitting and you're tucking. And of course, you would do that on both sides. Okay. Any questions on hip flex? Oh, just shocked myself. Hip flexors before we move on to the next muscle group. Lying flat on my stomach is hard. Lying flat on your stomach can be a good hip flexor stretch for sure, but there's other options like the one that I just told you. After rest, especially during the night when I get up to go to the bathroom, all movement is better, but it quickly disappears. Can this get better? Yes, absolutely. Standing straight seems to be hard because of weak glutes, not tight hip flexors. Yes, absolutely. So there's lots of reasons that you could be experiencing any symptom. So how do I want to phrase this? For every issue or symptom, there's typically two things going on. Weakness on one side and tightness on the other side. So when we're talking about things like hinging forward, so if we're hinging forward, as I just mentioned, one thing that could be causing that is tightness in the hip flexors. They're shortened, so you're hinging forward. Another thing that could be causing that is weakness in your glutes and hamstrings on your backside. If you have weakness here, it's going to be hard to pull yourself back up. So hinging could be due to tight hip flexors or weak glutes and hamstrings or both. So every movement, every action, everything that's hard usually has one or both of those happening. One muscle group being tight and then another muscle group on the opposite side being weak. For example, we talked about difficulty lifting your leg. One reason that might be is what we've already discussed, weakness in the hip flexors. Another reason could be tightness on the backside, tightness in your glutes and hamstrings. If these muscles are tight, it's going to make it really hard to pull your leg forward because it's keeping your leg back. So what we're discussing today is just a few of the many possibilities of what could be causing your symptoms. Okay. How can you tell if your glutes are weak? You can tell if your glutes are weak if you're hinging forward, that might be one sign, but also if you're standing and you try to kick one leg behind you and it's really, really hard, that could be a sign that your glutes are weak. If that's too hard, you could try lying on your stomach and seeing if you can lift one leg up off of the bed or the couch, whatever it is that you're lying on. If that's really hard, that's another sign of glute weakness. The next muscle group I want to talk about are the knee extensors, which are your quadriceps or your quad muscles. These are the muscles on the front of your thigh. So if you're sitting right now and you look down at your legs, that's the front of your thigh. Those are your quad muscles, your quadriceps. So what do these muscles do? They straighten your knee. They also can lock the knee in place when standing, and we need our quadricep muscles for things like standing up from a chair, walking down stairs and upstairs, controlling your movement when standing up and sitting down, staying balanced when you're standing and when you're walking. So having some strength and flexibility here generally often allows mobility and walking to feel much more smooth and easy, simplified. When these muscles are weak or tight, it can drastically affect our walking. And the quadriceps often revolve around our knee. So if you think of if your knee feels hard to bend or straighten, that usually is a quadricep muscle imbalance. So if your knee extensors or your quadriceps are tight or weak, how will you know that? Here's what you need to know. If your knee extensors or your quads are weak, you might notice that your knee buckles or gives way when you're walking. So if you're walking and it kind of collapses. You might notice that you have difficulty controlling standing up or sitting down. You might just plop. You might feel like you have difficulty controlling going downstairs. We use these muscles a lot when we're going downstairs. So if you feel like you're kind of plopping down the stairs and you don't have that control, it could be due to weak quadricep muscles. And you also might notice that your knee locks or hyperextends, pushes backwards, because when you have weakness, your quadriceps can't work as well. So you'll either see that knee buckling or the opposite of that knee hyperextending and locking. If your quadricep muscles are tight, then it can be really difficult to bend your knee. This is one of the most common things that I see, symptoms that I see in my clients with MS, is difficulty bending their knee. And one reason for that, one of several, is tightness in your quadricep muscles. If you feel like you have a very stiff leg, that could be tight quadriceps. If you have knee pain, that could be tight quadriceps. And reduced ability to climb stairs, going up or down, that could be tightness in your quadriceps. So what are some exercises that we can do about this? Number one, we can do some mini squats with or without support. Number two is seated knee extension. Number three is standing knee extension. And then number four is quad stretches. So let's practice those together. A great exercise to help improve quad or quadricep strength is going to be mini squats. And first, let me just point out where we're talking about. So these are our quads. Our quadricep muscles start up at our hips and run all the way down to right below our knee. So they're pretty long muscles. There's four of them. That's why they're called quadriceps. So it starts here, comes all the way down, and they're responsible for straightening our knee. So if we have knee weakness, that's when you might feel like your knee's buckling or locking, hyperextending, and like you don't have control over your leg. So one exercise is the mini squats. One way that you can do this is with a mobility aid. You're going to hold on. Your feet are nice and wide. You're going to hinge your hips back and then just bend a little, just maybe 1 inch, maybe 2 inches, just a little bit. Hold, and you should feel these muscles working, and then stand up and repeat. So it's just a little squat. You're not going as low as you can go, just a little bit. Bend those knees just a little and straighten. And bend and straighten. This is an exercise to strengthen your quadricep muscles. Another exercise that you could do is knee extension, standing or sitting. I'll show you standing first because I'm already standing. One way that I like to do this exercise standing is to have my weight on my front leg, and there's just a little bit of weight on the back leg, and you're going to straighten that knee and then relax and straighten and relax. When you're straightening, that's your quad muscles that you're using. So this is a quad strengthening exercise. When you're seated, it looks very different. When you're sitting, you're going to sit up tall and you're going to slowly straighten your knee and then relax and bring it back. And then you can do the other side. Slowly straighten and relax. That straightening is when you're strengthening your quadricep muscles. And back. If it's too hard to do in this position, then add less friction. Remove friction from this movement. Meaning, if this is not slippery enough, put a book or a magazine or something under your foot to make it slippery. The more slippery, the less friction and the easier it should be to do that exercise. or sit on a higher surface so that your feet aren't touching the ground, like if you have a tall bed, and you can do that. Quadricep stretches, I like to do the one that we did for the hip flexors. So seated was this variation. This can also stretch your quad muscles. And if you do feel it in both areas, this would be a great one to do for your hip flexors and your quadricep muscles. But I also really like massaging my muscles, specifically the quadriceps. So you can use your own hands. You could use a tennis ball. You could use a muscle roller stick, anything to loosen those quadricep muscles or those knee extensors. And you could do this before exercise, during, or even after your exercises. Please explain how to isolate the quads from the hip flexors during the exercises. So when it comes to using our quadricep muscles and our hip flexor muscles, sometimes there's not anything that we can do to isolate them. Like if you're walking, you're going to be using both your knee flexors, knee extensors, hip flexors. You're going to be using a lot of muscles. The way to use just one muscle group, which is what I specialize in, because using just one muscle group makes it a lot harder, but it also identifies where your biggest areas of weakness are, and so that we can focus on those. So with the exercise that we were just doing with the knee extension, the way that you would know if you're using only your knee extensors, not your hip flexors, is if your knee is only straightening and not also lifting. Here's what I mean. Let me go back to my chair. So if I am just straightening my knee, notice how far away my heel is from the floor. This is what it looks like if I'm just straightening my knee and then bending, and straighten and bend. But if it looks like this, if I'm all the way up here, that's my hip flexors and my knee extensors. I'm using both. So oftentimes you'll know if you're using just one muscle group versus two muscle groups based on how much movement you see. So many people look like this or attempt to look like this. That is not isolating your knee extensors. Knee extensors is just the straightening. If your leg's up here, that's also your hip flexors kicking in. If we go back to the marching exercise, which was this, you'll know that your knee extensors are kicking in. If it doesn't look like this, it looks like this. If your knee is straightening a bit, it's both your hip flexors and your knee extensors. I hope that makes sense. Kevin says this is where we ask questions. Yes. Is it okay to lift the thigh with hand to do knee extensions? Yes. If you are having a hard time extending your knee because your foot is too close to the ground and you don't have hip flexor strength to lift it, you can lift with your hands. But before you do that, I would rather you put something slippery under your foot. So if you're doing this on tile or hardwood floors, then maybe you get a sock on your foot or a dish towel and try to slide with that. If you're like me on carpet, then I could put, I just happen to have this plastic thing here. Plastic is going to be slippery on carpet. So I could put my foot on this and try to slide. So make it slippery. If that still doesn't work, sit on a higher surface so that your feet aren't touching the ground at all. If those don't work for you or you can't find that setting, then you can use your arms to lift your leg. Our next muscle group is the knee flexors. You likely know of these as your hamstrings. So they are on the opposite side of our quadricep muscle. So when we look down, those are the quads. On the back side is our hamstrings. So our hamstrings are mostly responsible for bending our knee. as I said previously, bending our knee is one of the most challenging things to do, muscles to work, actions to accomplish for my clients. So that could be due to extensor or quadricep tightness, as we've already established, or hamstring weakness. So it helps with bending your knee. It can also help control hip extension. Our hamstrings are essential for walking, for any time that we need to bend our knee. So walking forward, walking backwards, controlling downward movements, climbing stairs, balance when we're standing, getting in and out of a car, in and out of our shower, our bed. Anytime we need to bend our knee, we need our hamstrings to work. When our hamstrings or knee flexors are weak, mostly you'll notice difficulty bending your knee. You might also notice difficulty controlling your leg when you're walking. Your leg might feel really loose and like you can't control it. You might notice a slower walking speed. You might notice some balance problems, and you might notice difficulty stepping backward. If your knee flexors or your hamstrings are tight, you might notice that it's really hard to straighten your knee. And therefore, it might be hard to take a full stride length, a full step length, because it's hard to straighten your knee fully. If your hamstrings are tight, you might notice low back pain. You might notice difficulty balancing, because again, you might feel that wobbly, and you might feel any type of knee pain on the front or back of your knee due to muscular imbalance. Some exercises that you can do for knee flexors or your hamstrings is seated hamstring curls, standing hamstring curls, and hamstring stretches. So let's review those. And I see a question before we move on to hamstring. Should the foot be extended when seated? The foot, it doesn't matter what your foot is doing for any of the exercises that we've done thus far. You don't have to worry about flexing it or straightening it. Whatever feels good for you is good. Okay, so our hamstrings are the muscles on the back of our thigh. The hamstring runs from the bone that we sit on, often called our sit bone. So when you're sitting and you feel that bone, that's where the hamstring attaches, and it goes all the way down the back of your thigh to behind your knee, and it's responsible for bending your knee. Whether you're standing, sitting, lying down, if you're bending your knee, it's your hamstrings that are doing that action. So some things that we can do to strengthen our hamstrings are some hamstring curls, or if we want to stretch our hamstrings, we can do a hamstring stretch. So I'll show you in a standing position first. If we are going to be strengthening our hamstrings, you can do that by bending one knee. And here, it doesn't matter what your foot is doing. It doesn't have to stay flexed or pointed. Whatever your foot wants to do is fine, but you're going to bend your knee. Now, this is a really hard position to bend your knee. Oftentimes, I'll have my missing link members stand in a staggered stance with their body weight on their front leg. So that's this leg, less weight through here, and you bend from there. And just bend as much as you can, even if it's a centimeter. That's great. It doesn't need to be a lot of movement. This is what that standing version looks like. And of course, you do the same thing on the other side. The seated version looks like this. And one thing I think is really important to mention about the seated version is it does not matter what type of chair you are sitting in. Right now, this chair has no hole through it. My computer chair that I was sitting on, there's nothing underneath, so my foot can glide through. Both are great options. You don't need a specific type of chair. Any chair will work. So you're going to sit in a chair and sitting as far back as you can, feet are flat on the ground, and you're going to pull your foot so that your heel comes back. If you're in a chair like this, it's going to be a little bit harder because you're going to push into this chair, this surface, push, 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 and you're going to feel that behind your knee and behind your thigh. And then you do the same thing on the other side. Push, push, push. If it's too hard, same advice as the seated knee extension. Put something slippery under your foot so your foot can slide easier, or sit on a taller surface so that your foot's dangling, it's not touching the ground. If you need to, you can use your hands to lift and push from there. If you are on a surface that doesn't have something hard like that, you could do this. You'll see there's an opening here. Same exercise. Seated, brakes are on, and you're just gonna slide under and then back to the center and slide and back. So that's what the hamstring curl would look like, seated or standing, to strengthen your hamstrings. When it comes to stretching our hamstrings, again, you can do that seated or standing. I prefer seated. What that's going to look like is the leg that you want to stretch comes out straight. Try to get that knee as straight as possible. Doesn't matter what your foot is doing. Sit up tall and with a flat back, hinge forward. And you should feel that stretch anywhere behind your thigh, anywhere from your sit bone all the way to behind your knee. And you'd hold that stretch there. You do the same thing on the other side. That's the seated version. The standing version, if you have steps at home, and if you can do so safely, you can put your leg on a step and hinge forward with a flat back, or put your leg forward and hinge like this. There's so many different ways, but generally you want the leg straight and you hinge forward. So you can find what works for you. Is there a prone hamstring curl? So you can do a hamstring curl let me back up. You can do a hamstring curl in lots of positions. There's like 7 different positions that you can do a hamstring curl in. Very similar to the marching exercise that we did for the hip flexors. You can do those in lots of positions. These are the 2 that I find best for everyday use because we're usually sitting or standing throughout the day, but you can do a hamstring curl lying on your side, lying on your stomach, lying on your back. You can do the marching exercise, lying on your stomach, lying on your side, lying on your back, in addition to the seated and standing. Ankle dorsiflexors is our next muscle group that MS tends to attack. These are the muscles on the front of our ankle, and these are responsible for lifting our toes and the front of our foot upward. So you might be thinking, hopefully, that if lifting your ankle or foot is hard, that is often a big reason for foot drop. So if you have foot drop, this might be something that you're struggling with. So the ankle dorsiflexors, front of our ankle, responsible for lifting our toes, lifting our forefoot up. It's also responsible for controlling our foot placement during walking so that your foot lands and slowly rolls forward instead of slapping. Ankle dorsiflexors are essential for clearing your foot during the swing phase of walking, preventing tripping, controlling your foot placement when walking and on stairs, and initial contact when walking. Your heel should hit the ground first. So when your ankle dorsiflexors are weak, you will likely notice foot drop, toe drag, foot slap, foot drag. There's so many different names for it, but if any of those are words you've heard before, it is likely due to a component of weak ankle dorsiflexors. You might notice increased tripping, scuffing your toes when walking, slapping your foot down when walking. If you can hear your foot slap the ground with every step, weak ankle dorsiflexors, and difficulty going downstairs as well. If your ankle dorsiflexors are tight, and this is definitely less common, but it can happen. If they are tight, you will notice limited ankle range of motion. So instead of being able to freely lift your ankle, even with your hand, you'll notice you can't move your ankle as much because it's too tight. It may affect your balance, it may affect stair climbing, and it may cause ankle pain. So some exercises that we can do for weak or tight ankles is seated ankle dorsiflexion, standing heel raises, ankle pumps, and then considering some type of ankle brace, whether that's an ankle foot orthosis, an AFO, or a brace like the Dictus band or Elevate 360. So let's do some of those exercises. My favorite exercise of all time for weak ankle dorsiflexors. And before we even do that, ankle dorsiflexors are the front of our ankle. They're right in this area on both sides. So if those are weak, our toes are likely to stay down and lifting is going to be hard. So one of the best things we can do is practice lifting them. So if we have weakness here, we want to practice lifting, but it's going to be much harder to do that when your knees are at 90 degrees. So you can extend your knees a bit and then lift from there. You can lift one side at a time or both at the same time. You don't have to lift as high as I'm going. You could just lift the tiniest bit, but lifting is going to be a great exercise to strengthen those muscles on the front of your ankle. So I often do this in a seated position, not standing. Standing is likely you lose your balance, but this is what it would look like if you're going back and forth. This is what it would look like if you're doing them at the same time. And up and down, slow and steady, slow on the way up, little pause, slow on the way down. So that's a great strengthening exercise. Now, when it comes to tight ankle dorsiflexors, this would mean that if your ankle is stuck in this flexed position and it's really hard to let your foot down, then some stretches and movement is what can be great. So something like grabbing your hand and just doing some ankle circles or ankle pumps. You can move up and down, in and out. There's no right or wrong, just get your ankle moving. And you can go the other direction. And then you can also massage the ankle dorsiflexor. So using this hand, you're going to massage those muscles and tendons right on the front of your ankle. You could even come up a little bit higher as well. So anywhere in this range is good, fair game to massage, rub around, whatever feels good for you. There's no specific motion that you should be doing, but just trying to loosen those muscles up. One of the exercises that I mentioned that could be helpful is calf raises, but we're going to save that for our next muscle group. For now, the ankle dorsiflexors and lifting like this is going to be the best for strengthening. Massage and moving around can be great for mobility. And then the last stretch is simply pulling your toes away. So if you have tightness up top, you pull down and point your toes down, and that can feel like a really great stretch. Is there anything I can do for my pillows, driving them? They're starting to curl. I think you mean toes. There's lots of things that you can do for your toes, just very quickly, because we do have some more to get through for this talk. Oftentimes, if your toes are curling when you're standing, it's due to poor balance. So working on balance can be helpful. My feet roll side to side. What muscle is that? That's more of the outside of your calf muscles, or outside of your calf, your peroneal or fibular muscles. With your ankle on knee, pushing other knee down stretches what? If you're in that position that I was in, you push your knee down, that stretches your hip muscles. Okay, I've got one more muscle group to go through. So the last muscle group that we're going to review are your calf muscles. So your calf muscles are the muscles on the back of your lower leg. Most people know where our calf muscles are, but if you're looking down at your heel, the muscles right above your heel, that whole back of your lower leg, those are your calf muscles. Those are the muscles that are responsible for lifting your heel. So I skipped a slide. There we go. Those are the muscles that are going to be responsible for lifting your heel, aka toes are pointing down and heel is up. This is an extremely important movement when we're talking about walking. A big component of taking a step forward is being able to push off of your back leg. That's what your calf muscles primarily help with when walking. So it's essential for propelling us, propulsion in moving in a forward direction, staying balanced during standing and walking, climbing stairs, and rising up on our toes. So when our calf muscles are weak, you will notice that pushing off as you're walking forward during a gait cycle can be challenging. You have difficulty with balance, difficulty climbing stairs. You may compensate with hip hiking, and I'll demonstrate what that looks like too. When your calf muscles are tight, you might notice limited ankle mobility because you can't lift it as high. You have increased foot drop or foot slap. You might have difficulty getting your heel down. You might have knee hyperextension or locking, and balance problems because our calves help us stay balanced. So some exercises that you can do for your calves are heel raises, seated or standing, calf stretches, and balance exercises. So let's review those. Our calf muscles are the muscles on the back of our lower leg. They run from behind our knee all the way down to our heel. They are responsible for our heels coming up and toes pointing down, which, as I mentioned, is an important point of walking right here. As I'm going to take a step forward, this is the push-off phase of gait, where my heel comes up, my toes are down, and then I bring my leg through. So pushing off is where we need our calf muscles. So if you have weakness, that can be really hard. So an exercise that you can do is standing heel raises, where you're standing, core is tight, and you lift up and down, slowly on the way up and slowly on the way down. When you're doing those seated, it might look like this. Slowly on the way up, slowly on the way down, controlled. So it's the same exercise, you're just sitting instead of standing. Now, if your calf muscles are tight, you want to do a calf stretch. I really like doing calf stretches with tools to help me out, and specifically non-stretchy tools. So not a resistance band, not resistance tubing, but something like a cane or a yoga strap that is taut, it's not stretchy. And you're going to straighten your leg, ideally straightening your knee as well, and then putting a non-stretchy object under the balls of your feet and pulling towards you. The tighter your calf muscles are, the more your toes are going to want to stay down. So we're pulling our toes up to stretch our calf. Ideally, you'd feel that stretch anywhere behind your knee, all the way down to behind your heel. And you're going to pull towards you. If you have foot drop or foot slap, foot drag, it's often a combination of tightness in your calf muscles and weakness on the front, the ankle dorsiflexors like we just discussed. So that's what you can do to stretch the calf muscles. So putting all of this together, when we are talking about walking and climbing stairs, it requires all of these muscle groups that we talked about and more. It also requires our hip extensors, our core muscles, so many other muscles. But when we're talking about walking, our hip flexors are the muscles that bring our leg forward. Our knee extensors straighten our knee so that we can put our leg down forward, and it supports us during our stance phase where that leg is on the ground. The knee flexors allows us to bend our knee. Our ankle dorsiflexors allows us to lift our foot. Our calf muscle allows us to push forward. So all of these muscles are required to have strength and flexibility for us to take a single step forward, let alone multiple steps forward, and climb stairs and getting in and out of the shower, our car, etc. They are so important, and they are often the muscles that MS tends to attack and affect. So when we're thinking about what muscles should we be strengthening or stretching, there's lots of muscles to strengthen and stretch. What I would recommend doing is go through Each of the things that we've discussed, lifting your leg up, straightening your knee, bending your knee, and seeing which feels challenging. Maybe it's all of them, maybe it's just some of them, and start with some of the exercises that we've discussed and go from there. Once those start feeling easier, then you can add some other things. But when it comes to walking, stairs, etc., we use our hip flexors, our knee extensors, knee flexors, ankle dorsiflexors, calf muscles for every single step of those movements. Exercise guidelines that I want to leave you with today. When to strengthen. Start with the most challenging muscles first. Oftentimes, I find that if you're starting with the most challenging muscles first, while it might feel defeating and discouraging because it's really hard to strengthen and move them, it can be really eye-opening of how much strength is needed. And I would encourage you to feel a sense of pride that you are choosing to isolate that muscle and really focus on strengthening the specific muscle that you're noticing that weakness in. You're more likely to notice a bigger bang for your buck in terms of exercise when you focus on those specific muscles. Quality over quantity, it's not about how many repetitions you can do, but how many good quality repetitions you can do. You can do an aerobic exercise first, get your heart rate up. That can prime your brain for neuroplasticity, take breaks as needed, and practice in functional positions when possible. When to stretch, when your muscles feel tight or spastic. Generally speaking, you want to hold for 20 to 30 seconds if you're doing a typical static stretch. If that doesn't feel good for you, a way that you can stretch is dynamic stretching, where you only hold for about 2 to 3 seconds, and you would just do more repetitions, maybe 30 repetitions. Or you can do a prolonged static. So you might hold for 5 to 7 minutes before you release and do a different stretch, and focus on problem areas. One thing I frequently hear from my clients is, Dr. Gretchen, I stretch all day long, but I'm still so spastic. My knee still doesn't bend. And every time I ask the client who's saying this, great, what stretches are you doing? Tell me what you're doing. They'll mention a ton of stretches, but not one of them is for the specific thing that they are trying to alleviate. So for example, I had a patient who said that the muscles on the front of her thigh, her quadricep muscles, were so tight. Nothing she does is helping. She's stretching all day long. She told me her stretches, not one of them was a quad stretch. So of course they're not feeling any better. So focus on the problem areas, and hopefully after today's discussion, you feel like you know where those problem areas might be, and you have some exercises for those specific problem areas. I hope you found this helpful. This is a lot of information all at once. And again, MS can attack any muscle. These are just some of the most common ones that MS tends to attack, causing weakness and or tightness. So hopefully you now feel like you've got some tools in your toolbox of helping you navigate and figure out what might actually be going on with your muscles, and some tools to help you overcome that. If you are looking to reach me anywhere, here's some resources. My Missing Link book is the book I published that reviews all strategies similar to these and much more. My website is missinglink.com if you want to work with me or are curious about any other resources I have. And I also have an app called The Missing Link. And I also have Instagram and YouTube channel. There's also Facebook, podcast. I'm all over, but these are some of the most common platforms that people find me on. So there are two calf muscles, a soleus muscle and the gastrocnemius or gastroc muscle. Those are two calf muscles. The way that you stretch the gastroc muscle is what you just saw me do, where your knee is fully straight and you pull to straighten pull your toes towards you. The way to stretch the soleus is the same stretch, but bend your knee. With the knee bent, you're going to get more of the soleus stretch. Awesome presentation. Can't wait to watch it again and practice the exercises. Yeah, this is a loaded talk. This is recorded, so you can definitely watch this again. Take your time processing all of this information. My calf muscles are very tight. I can do calf raises better when I'm standing, not sitting, which is very hard. So when your calf When you're standing, your knees are straight, and when you're sitting, your knees are bent. So that can make doing exercises standing or sitting very different in terms of how challenging they are for you, because your knees are in a different position and therefore your muscles are in a different position. So for you, when you're standing, when your knees are straight, when your muscles are straight, it's easier for you to use. But when your knees are bent and your muscles are bent, it's harder for you. So it's because of the alignment and what position your muscles are in when you're starting the exercise. When I have weak ankle dorsiflexors, am I needing to strengthen my muscles or am I attempting to create? So when you have weak ankle dorsiflexors, you should work on strengthening your ankle dorsiflexors. By doing that, you're also working to create new neural pathways or strengthening neural pathways that already exist but are weakened. It's always amazing how muscle memory kicks in. I try to remember that. Thank you, Dr. Gretchen. Sorry about those Buffalo Bills this year. That was a tearjerker, but they did play great. Maybe next year, hopefully next year. I have drop leg and drop foot. Where should I start? It's hard to say where you should start because it depends why that's happening. Drop foot can happen due to ankle dorsiflexors being weak or tight calf muscles or weak hip flexors or weak knee flexors. So many different reasons. So it really depends on what the cause is, which could be lots of the things that we talked about today. So starting some of those exercises and seeing where are the big problem areas for you. Why can I use my leg semi-normally while sitting, but I have to drag it around when attempting to walk? Very similar to what I mentioned for the previous question. When we're sitting, our muscles are in a completely different position than when we're standing. When we're sitting, our hip flexors are in a bent position. Our knee flexors are in a bent position. Also, when we're sitting, our body doesn't have to focus on balance too much. So when we're standing, our hip flexors are straight. Our knee flexors are straight, and we have to focus on balance. So not only are our muscles in a different position, but we're focusing on two things at once, balancing and using our muscles, which can be a lot harder. So those are just a few reasons of why it might be harder for you to use your legs when standing versus sitting. Thanks from an OT with MS from Buffalo. We're neighbors. I'm in Batavia. Awesome. All right, I will let you guys go. Thanks so much for everyone tuning in. I know we definitely went a little bit over. I love talking about this stuff. I just think it's so important for you to know what muscles are impacting and are affected from your MS that could affect your walking, because if you know what muscles are weak or tight, you can do something about it. If you don't know, it's just kind of like you're throwing spaghetti at the wall hoping that any old exercise will work, and oftentimes it doesn't. So thank you to MS Visa News for collaborating with me so we can offer this to you, and thank you to Viatris for being our supporter. Thank you for you guys for tuning in and learning with me. Thank you so much for participating as well, and I will see you guys next month. Have a great rest of your day.